Now on Health Matters, there's no doubt that medical doctors are essential workers in the day-to-day affairs of the health sector across the globe. Well, in recent years, there have been a mass exodus of Nigerian doctors to Western countries, all in search of greener pastures. One aspect that has completely been neglected is the unregulated working hours, and this is greatly influenced the brain drain syndrome.
Research conducted by the Nigerian Journal of Clinical Practice reveals that in Nigeria there is a doctor ratio of 1 to 9,000 patients as against the 1 to 600 patients recommended by the World Health Organization. In this next piece, it reveals that many medical doctors may work for 72 hours unregulated shifts, making them burn out and also increasing medical errors. Take a listen.
The provision of adequate manpower is essential to operating a functional health facility across the globe. This entails the availability of medical doctors, nurses, lab scientists, and other health workers. But in recent years, Nigeria has been experiencing an increase in the number of its indigenous medical doctors leaving the country for other Western countries in droves. This is as a result of poor remuneration, poor welfare packages, and unregulated working hours of medical doctors. One aspect that has completely been neglected, which is taking a toll on the mental health of practitioners, is the unregulated working hours, and this is greatly influencing the brain drain syndrome in the country. This has forced many medical doctors to work for 72 hours unregulated shifts, making them burn out and also increasing medical errors. Dr. Micah Otu is a physician with one of the tertiary health facilities in Nasarawa State. He arrives at his office to meet patients waiting for consultation. This forms part of his daily routine, aside other clinical services that require him to work for a 72-hour non-stop shift.
Very strenuous. The work schedule is tight. So as a doctor, I come to work usually, and the clinic is usually very heavy. Usually it's once a week, and then the next day is our ward rounds, and then our unit take calls. Because usually in some centers there are no house officers, so the doctor on call will work from the morning of that day till the end of work the following day, because there is nobody to take over from him.
Just a stone throw within the same facility is Dr. Noah Victor, who is a pediatrician. His story is not different from the former.
We still have doctors working for 36 hours straight. That's because they do 24 hours call, and then the next day they continue the duty as if nothing happened the next day.
Dr. Alamin Usman is a Nigerian medical doctor in the United Kingdom who I met via LinkedIn. In this interview with TVC News, he tells us about the working hour model of the United Kingdom and why it is attractive to Nigerian doctors.
Here in the United Kingdom, they have adopted, the General Medical Council, which regulates the working hours and every affair of every doctor here in the United Kingdom, has adopted, the European Working Time Directive for all workers, and it stated that every worker works just 40 hours a week.
Dr. Alamin and other Nigerian physicians agreed that the ball rests in the court of the Medical and Dental Council of Nigeria to design a policy for regulation of working hours of doctors.
We need to know where we're starting from, and then we need to look at other systems, compare other systems. This is where the studies, the research comes in, which is very important.
The Princess of Wales has been diagnosed with the cancer and is in the early stage of treatment. She reveals in a recorded statement that the condition was discovered after she had abdominal surgery in January. We have more in the space.
In 1 month, news about the British royals has been shocking. From the photo controversy early March to the Princess of Wales' announcement of cancer diagnosis and chemotherapy treatment on Friday. This announcement comes 2 months after Kate stepped away from public life temporarily following what Kensington Palace said at the time was surgery for non-cancerous abdominal condition. After weeks of speculation about her health, the Princess of Wales said she and her husband, Prince William, had needed time to explain the situation to their 3 children.
Incredibly tough couple of months for our entire family, but I've had a fantastic medical team who've taken great care of me, for which I'm so grateful. I am well and getting stronger every day by focusing on the things that will help me heal in my mind, body and spirits. Having William by my side is a great source of comfort and reassurance too, as is the love, support and kindness that has been shown by so many of you. It means so much to us both. We hope that you'll understand that as a family, we now need some time, space and privacy while I complete my treatment. My work has always brought me a deep sense of joy, and I look forward to being back when I'm able. But for now, I must focus on making a full recovery.
The news, which the Princess described as a huge shock, has prompted a wave of sympathy from the UK Prime Minister Rishi Sunak and the White House. After a shocking revelation, British Prime Minister Rishi Sunak said Prince of Wales has the love and support of the whole country. The Prime Minister in a statement on X said that Kate Middleton has shown tremendous bravery with her statement and that his thoughts are with her and in particular 3 children. For the White House, the Biden administration is incredibly sad to hear of the news. Moments after the news broke, White House Press Secretary said on Friday, quote, "Our thoughts are with the Duchess of Cambridge and her family members and friends during this incredibly difficult time, and certainly we wish her a full recovery." From the Buckingham Palace, King Charles said he is, quote, "so proud of Catherine for her courage in speaking as she did, following the announcement by the Princess of Wales that she had cancer." Buckingham Palace said King Charles, who was also diagnosed with cancer following a procedure for an enlarged prostate, remains in the closest contact with his beloved daughter-in-law. Both their majesties will continue to offer their love and support to the whole family through this difficult time, end quote.
We wish the Princess of Wales good health as she undergoes this surgery. But of course, what we're actually looking at is the brain drain some of the doctors leaving Nigeria. To give more insight of this issue is the Managing Director of Alliance Hospital, Dr. Christopher Otabo. Thank you very much for joining us, Doctor.
Thank you for having me. Good morning.
Good morning. Thank you. You know, it's really no longer news. In the last few years, so many Nigerian doctors have left the shores of this country. And why do you think at this time, you know, we need a lot of doctors, especially if you look at after the pandemic in 2020, some of these doctors have left the shores of Nigeria?
Well, the statistics are actually depressing.
Yeah.
In 2015, an average of 200 doctors left the country per year.
Wow.
But by 2022, 23, we're having an average of 1,000 leaving the country per year. That's a 5-fold increase. And there's something that parallels that, which is the value of our currency. So why would doctors leave? Not just doctors, healthcare practitioners in general and professionals. Doctors would gravitate towards places where they find fulfillment in their work. And 2 things would give doctors fulfillment. One is having the tools with which to save lives. And secondly, they have to have good pay that can give them a meaningful life themselves. If a doctor is paid all the money in the world and yet he doesn't have the tools to save lives for which he's trained and he's seeing people dying every day, he will leave. So these are the 2 critical things, and we must look into them in order to stop this, because it's a disaster waiting. People didn't know that Nigeria was in economic crisis until the bubble burst. Now we are in health crisis, and if nothing is done in a few years, the bubble will burst in the health sector.
You know, I just wanted to follow up on that question. Economic crisis is everywhere in the world. You know,
Yes.
It's not new to Nigeria alone. But how do you think that we need to start thinking about human life first? You know, yes, I know everybody wants to get paid, but the human lives are also very important at this particular point in time.
Yeah, you, as a doctor or a healthcare professional, you must save your life first. When you are in the plane and they say, look, if there's a problem, put your oxygen mask first before you save others, even if it's your child. A doctor that is not well paid, a doctor that is not mental, that is not psychologically sound, would not be able to take care of other people. So the doctors must take care of themselves first and other healthcare professionals before they are in a position to take care of others. Now, I agree that the crisis is all over the world. See, that's why we talk about the pull and the push factors. There are things that are pushing Nigerian doctors out, and there are things that are pulling them to those countries. We need to look at them, and it's not rocket science. We can solve the problems here. India was in a situation like that many years ago. And today, Nigerian patients are going to India because the brain drain and medical tourism, they are twin evils that are affecting the country, and they are intertwined. But today, what's happening? Nigerians and other nationals are heading for India for medical care. Why? There are doctors all over the world were encouraged by their governments. They got cheap loans. They were encouraged to set up big hospitals, the Fortis hospitals of this world, the Apollo hospitals of this world. And they set up moments of brilliance, excellence across India. It's not as if there are no health care challenges in India. But these hospitals that have become center of excellence have been able to solve their own critical health issues, and they are also bringing in people from outside India, and it's giving them so much money. Nigerian government can do that. I know that the government does not have money, but they have goodwill. For instance, if you say, look, all the private hospitals that are doing well, we want to look at you, evaluate you, and see how we can take you to the next level. We want to give you free land to build state-of-the-art hospitals. And we want to, we will not give you money, but we can guarantee loans for you. I mean, before you know it, you can have 20 of those hospitals across the country in all geopolitical zones. It's not the type of privatization that they do where they give people who don't have capacity, private establishments, when they take government establishment and give it to private sector. No, you profile the people that you are going to support. And in a short while, you're going to have a lot of activity in the health sector. And Nigerians abroad will start coming back. And we'll be able to tackle medical tourism. And we must also look at the health insurance, because that's another way of pulling in funds into the health sector.
Now, Nigerian doctors are some of the brightest and smartest in the world. Is it as a result of our education system, or it's simply because we are just better in our endeavors than the rest of the world?
Two things. Our educational system is standard. I went through that system. It parallels, it mirrors that of the UK. And secondly, the tenacity of our doctors. Look, in 2010, I wrote the Australian Medical Council exam, and I passed it first touch. When I went to the internet and I see some Indians or Pakistanis struggling to write it 7-8 times, and then I was scared at first, but when I wrote the exam in London, I passed it first time. 2010, that's 14 years ago. Yeah. Up till last month, I still got a letter from the Australian Medical Council requesting me to come.
Wow.
But I choose to stay, despite all the challenges. Yes, so we are good. Nigerians, if you take all the Nigerian doctors out of the UK health system, it will collapse. If you take Nigerian doctors out of the American healthcare system, it will collapse. Because Nigerians have migrated to those places and they find them to be fantastic doctors, both in terms of learning and character. So we are doing great things all over the world, but we must care for our own people. Yeah. And that's why we need good leadership from the government. This government is doing a lot, I must admit, in terms of healthcare. Okay. But they need to galvanize all that they have to be able to, to give clear leadership. And there must be clear plan, strategic investment and plan to reverse this trend. Otherwise, the dam will burst and it's going to be a big problem for the country.
When you talked about the fact that, first of all, congratulations. I think that's a big feat. You're one of the few Nigerians who would have that kind of opportunity and still stay back. I think that's a big thing.
Thank you.
Do you understand? That shows the level of the spirit of patriotism that you have. But how do you think? What urgency do you think we need to be doing to change the tide? I know that the government. I was listening to the Minister of Health and Social Welfare, where he was saying that policies that they're doing is trying to make sure that health workers, doctors come back to Nigeria. But how do you think that we need to keep government on their toes to make sure that all of these things happen and we are able to get our health sector back on track?
Many times we think that Nigerians think that when you elect people or people are appointed in office, we assume that they know what to do. It's not all the time. What we are doing like this, the media, you are interviewing people who have hands-on experience. So it's part of the response to the problem. So we must discuss these things at different fora. Medical associations must take on the challenge to discuss and bring out communique and put it on the doorstep of the government. And the government officials must not be too proud to listen to suggestions. But what is critical is strategic investment in healthcare. We must invest in equipment. We must invest in infrastructure. We must also take care of the security challenges, because if people are threatened, they want to leave. Last week, a doctor was kidnapped in Abuja here. And before he was released, his hands were broken. He has to undergo surgery to fix his bones. After recovery, if that guy has a chance, I don't know how he would want to stay back. So the security challenge also dovetail into the challenge that we are talking about. But overall, if we invest in the healthcare and make it attractive and bring in the private sector, support the private sector, because that's a low-hanging fruit, because government does not have the money, private sector can have the money. But if government brings the goodwill to support the private sector and say, look, we are behind you, we will give you loan at one-digit interest rate, and we can even backstop the loan. And then a lot can happen in a short time.
Thank you very much.
Thank you.
And that's, of course, a discussion on health and brain drain. That is Christopher Talbot, doctor, a medical doctor for that matter. Thank you very much for joining us.
You're welcome.
Thank you.
Now,